Today is Global Heart Day, and combining that with our Patient Day today, it's a fantastic opportunity to inform patients about how we develop and manufacture products to improve their quality of life.
It is really important that we have a good collaboration, and it works really well. There are a lot of people from the headquarters coming here, training people, helping people, and also people from here going to headquarters from time to time to see what, and we are doing improvement of the products together.
I shared with the participants about the solutions we have with the vascular intervention therapies. So we had nice discussion, we informing them about the company background, about what we stand for, and then most importantly the anatomy of body's vessels, and like I said, the solutions of these products.
Today my presentation is a lot about coronary artery disease, and I hope that patients will learn more about the process that affects their coronary arteries and how to treat and manage this disease. Such events are very useful to the lay public. It gives them a better understanding of the disease as well as how to prevent and how to treat such problems.
The two talks that I thought were the most beneficial were both by doctors. One was Dr. Paul Lim, who had an excellent talk on the electrical functions of the heart, and another talk was by Dr. Jonathan Yap, who gave a fantastic talk on the vascular system. Both of those very illuminating, and they took the time to answer all the questions that came from the floor.
I think I like the talk about the technology, to know more about the company, and also to hear from the clinical aspects of basically the two products, the cardiac machines, the pacemakers, and the vascular interventions.
Every topic was very good. I come to know more about the pacemaker, especially I had this insertion, so my daughter registered for me. I was very keen to know more about it. It was very useful.
We gave patients a very nice insight into who BIOTRONIK is and what the company behind their implants is all about. So I really do hope that they go home and they have more trust, they believe in the quality principle, and they have learned a lot about our manufacturing process and the products itself.